Hey everyone, welcome back to my channel. Today I want to talk to you about something really cool that we do in our office. It's the new patient experience, and I want to talk a little bit about it, especially because we had a comment on a previous video where the person wanted to know about our cleanings. And so in order to talk about that, I thought maybe we should rewind first and talk about, how a patient comes into our clinic and then how they get to that point of having the cleaning. So if you'd like to hear more about how a new patient comes to our clinic and what kind of experiences that they have and how we do it, then stay tuned and I'll share that with you. When you come to Peggy Bown Dentistry, the main thing that we want you to take away is the fact that you felt welcome and you felt like it was a unique experience, and it was something that usually patients will say across their mind, or they will say it out loud, that it just didn't feel like I was in a dental office. So I want to do that in a way because, and we've really focused as a team to try to make that happen, because we really know that a lot of past experiences that patients have had historically with dentistry and in dental clinics has been somewhat negative and or just very common. We want to make it very different, a unique experience, and something that makes you really maybe feel differently towards dentistry. So that is the goal. So when you first come through the door, there will be, of course, someone there to greet you, but we also have a patient care coordinator. Her name is Suzanne Keynes, and she's been we've been working together for many years, and her goal is to come out and make sure that she introduces herself and makes you feel very welcome and part of, helps you answer any questions that you may have. Hygienist is who actually is going to be doing the new patient experiences for the most part. They are very well trained with all the technologies, and they have reserved 80 minutes for you to get to know you and collect a lot of information and documentation to kind of make sure that we look at everything.
So welcome to the office, Sue. We're glad to have you here.
Thank you.
And how did you find us, Sue? Just tell me a little bit about your dental history.
In that room is very spacious, very bright. We want it to smell good. We usually have essential oils. We want to make sure that the air is good. We also have air purifiers in the area, and everything is clean and ready to go for you. Once you sit down, there's going to be a great opportunity to explain why you're there, what your goals are, what you really want to achieve in the short term and in the long term. If there's something specifically that's giving you trouble, of course we're going to make sure we make that our highest priority and address that right away. But if there's some long-term goals, or something to do with, it could be anything. Maybe you're missing teeth, or maybe you're worried about recession, or maybe you'd like to have a nicer smile. All these things, we're going to be really getting to know you and understand what your future goals are.
Okay, great. Well, you're definitely in the right place, because Dr. Bown specializes in cosmetic dentistry. So we're going to do a few things today, Sue, to get all of your diagnostic information together. We're going to make a chart for you, your own personal file, and your portfolio. And then we can really look at everything all together and get a treatment plan together for you. And then once we're done with all the diagnostic tools, I'll get Dr. Bown to come in, and she'll do a thorough exam for you. And then we'll explain everything to you about the treatment plan and go from there.
Great, thank you.
Once the hygienist has collected all the documents and all the information that's necessary, it is their job then to introduce the patient to the dentist.
All right. Hi, nice to meet you. I'm Dr. Peggy Bown. Yeah, welcome to our clinic.
So the dentist, myself, or Dr. Isaacs will come in the room, sit down with you, again, face to face. We don't like to meet people when they're laying back, so it's a very comfortable situation for hopefully the patient especially, and us. We get to know you, of course, briefly at first, but the hygienist is very integral in making the introduction and making the transition of all the information that you just gave the hygienist to the dentist, so you don't have to say it all over again. So we like to make that easy for you, and then of course you can help fill in the blanks if the hygienist has missed anything. But the hygienist does basically, I think of it as sort of a presentation for the dentist in a way that is very organized and helps the patient, helps you feel like we have listened.
So Jess, what did you guys talk about today?
So Dr. Bown, Sue
Okay.
So she's really just looking to get back into the swing of things.
Yeah.
And she was just telling me that she's not happy with her smile,
Okay.
especially with the front teeth. And she feels like, you know, when she's smiling for photos, she really notices that some of the teeth are a bit crowded in there. So she'd really like to have us explain more about her bite.
Okay, okay. And so, is there anything else you want to add to that? Is that kind of what you were thinking, or?
Along those lines, yes.
Yeah.
I just would like to have a nicer smile and maybe a whiter smile.
Okay, okay. So what we're going to do right now is, as you saw, Jess has taken, you know, an intraoral scan. She's done some x-rays, a lot of photographs. So I'm going to go over those things with you. And then we're going to kind of identify any of those areas. And then at the end, I'm going to lay you back and we're going to do a complete exam where we do 6 screenings. And that kind of helps put everything into perspective. Once that's done, then I identify for you like what the concerns are that, you know, in the order, certainly that one of the orders that you want us to address, which is, you know, your chief complaint, your smile, but also kind of give you an idea of what your next steps would be and what type of treatment we recommend, and just go from there, okay?
Good, that's great.
Yeah, okay, so let's, so what I'll do is I'll come around and we're gonna look at the scan together first, and we'll go from there, okay? Okay, so I'm just gonna move this around so I can space you here. Okay, yeah, so, all right, so what did you think when you saw this?
Oh, it's amazing. I've never seen anything like it.
Yeah, so we do this on every patient, and we also do this on an annual basis. So we'll do this every year, and that will help us track not just sort of what you are in one moment in time, but the scanner can actually put the scans together and actually run a time-lapse video so that you can see if things are getting worse, how fast they're going to be getting worse, or maybe they're not changing at all. Because this is a snapshot of your recession, of your wear, anything that's happening here right now, but we don't know right now. We just met you. We don't know if it's getting worse. We don't know how fast it is, if it is getting worse, how fast that's happening. So this is a great starting point today. It's kind of like a baseline for you. Yeah, so we're gonna look closely here. And one of the things I noticed you had mentioned to Jess too is how much recession you see here, right?
That's the farm that I do. It's a bit sensitive down there, so.
Okay, yeah, that was going to be my next question. So you find it sensitive. Have you tried any sort of desensitizing agents or anything like that?
Well, no, I have not really. I just been kind of putting up with it, but
Okay.
I'm just gonna kind of guess I'm here to see what you have to say about that.
Yeah, okay. So we're going to give you some options for that. Of course, there's always desensitizing toothpaste and things like that, but our hygienists actually have a treatment that we can put on your teeth that will give you many months of desensitization. If you'd like to try that as well, that might be something we could do, given that there is a lot here of recession, you know. And did you realize it was this bad? Were you
No, I did
aware?
not. No, but that really shows it there. I can see
Yeah,
the brown or yellowish areas.
yeah, exactly.
Jess had pointed out to me, so
Yeah.
I did not realize. That's super cool.
Yeah. And so this here also, this shows me the shape of your arch. So the shapes of our arches are actually really important too. It's not just, you know, that all the teeth are relatively straight, but are they in a V shape or in a U shape, or sometimes they're actually in an omega shape. And that helps us determine things like maybe you have an underlying airway problem, maybe there's things that you're doing with your tongue or things you're doing at night that may be an issue. So if I look here at your arch form's slightly V, a little bit collapsed on this side, and that can really show or indicate why you may be having this recession. What we find is that teeth that are collapsed in a narrow way typically tend to have more recession. And so by uprighting the teeth, and sometimes we can do this, what we call this type of clear aligner therapy called Invisalign. Have you heard of Invisalign?
I have, yes.
Yeah, so it's a very gentle way to just upright everything and give us less force on those teeth. So it's something that we may want to think about and look at for a long-term strategy, because we don't want this to get worse, right? Do you, when I look here, do you have any trouble cleaning these areas? Like, do you find you get food stuck in, especially this area here? I see a little bit of buildup in here. So you can see this is a little bit of buildup that would kind of comes on teeth, especially in the lower front teeth, right? So what we'll do is we can run actually a simulation, or what we call even an occlusogram. So this actual scan will then show us, look here, and when I look in your mouth, I'm going to be looking to see if there's any indication that this is happening. But when we look here, this shows me areas where you're hitting not quite as heavy, and over here you're hitting much heavier. So there may be more recession or more wear on the teeth on this side where you're hitting heavier. So what we really want is we want both sides to be hitting evenly, and that would be much more balanced. As the body needs balance, and you can imagine if you had a pebble in your shoe, one hip would start to maybe hurt if you walked a long distance. The same thing happens with our joints and with our teeth. When we're kind of hitting one side too hard or too heavy, we tend to get wear. So we may see that when we lay you back. What I can do is verify that with some photographs that we've taken up here as well. So Jess, if you could open up this photograph here of the lower arch, we can look at that. And again, you see this. And in fact, when I look here, you can see there's a lot of natural enamel here, but over here it's quite worn. Do you ever have jaw pain or
I do, yeah.
clicking?
Clicking in my left side, my left joint.
Yeah. Okay. And then Jess, if you could show us the upper front teeth, maybe this picture here.
I need to get that chin fixed.
Yeah. Now it's interesting because not just should we fix it, but we should sort of figure out why that's happening, right? So again, that's probably showed up in the scan as well. And it may be that, you know, there's something happening with the way the teeth are aligned that's leading to that. And you can see that kind of thinning there. There was one other area, like the crowding here, maybe I could look at.
Yeah, so I would really like to hear more about the Invisalign now. I'm really interested in that.
Okay. So, all right, so what I'm going to do now, and we of course can see the resection even just as well as we did in the scan. When you do get older, we do find that patients this does get a little worse, or it's more at risk for decay, dental decay. So again, something that we may want to. This
And
tooth's
what would
kind of.
that line be that's right there on the tooth? What's that line?
Well,
It's like a crack.
Yeah, well that line is probably, there's a lot of stress on this. Canines do experience a little bit more stress sometimes than other teeth. And you know, the force is not necessarily directed up the long axis of the tooth, so it's starting to show its strain, and along with the recession there. And you can see that there as well. So yeah. Okay, so what I'm gonna do now is I'm gonna lay you back, look at everything, put it all together. The x-rays as well, Jess, if you could just show us those quickly, and those are at our fingertips as well. We look at the large pan, and there we go. Just looking at everything to make sure that looks all very good, actually. So that's really good. Yeah, and then let's look at the little x-rays. Wonderful. So we're looking for decay in these x-rays, and this is something that we certainly don't want to, you know, leave any stone unturned here, and we want to look very thoroughly. And sometimes the x-rays, depending on how higher risk for decay you have, I may not take your x-rays every year. Some people it's every 2 years. It just depends on your risk level, okay? And I'm looking here, I don't see any decay there, so that's really good. Yeah, okay, so let's lay you back. I'll take one look at everything, and then we'll go from there.
And then when I'm all done that, I will sit you up and I go, again, briefly review some of the things. I may reiterate why you're here, you know, what your goals are, and then come up with what we call a treatment plan. The treatment plan is, one of the things in the treatment plan is going to be the cleaning, because if you haven't had a cleaning for a while, or if you're due for a cleaning, that's going to be it. But the thing about the new patient experience is that we don't like to do the cleaning on the very first visit. And the reason for that is because we don't know your history. We don't know if you have sensitive teeth. We don't know if you've had a bad experience before. We don't know how much gingivitis you have. Maybe you have advanced gum disease. And if we just start cleaning your teeth without a really solid plan, then we may actually, you know, not give you the beneficial treatment that you need. So we need to know how much time we're going to need in order to basically perform that appointment. So the very first thing might be, if you don't have any pain or anything major, your next visit might be your cleaning, but it's going to be done in a way where we already have a great understanding of what your needs are before you even come in for that cleaning. And we have the appropriate amount of time booked for that appointment so that you are not rushed, and we have the right tools on hand to serve you. Secondly, I then talk about other parts of the treatment plan. So it could be the short-term parts of the treatment plan, the goals, you know, that there may be some fillings that you need first, where maybe we're going to bring you back for more documentation, which what we call is a digital smile design, or a design of, you know, rehabilitation for your mouth, maybe something like that that you need, and we do all that digitally, so that appointment as well is going to be very comfortable, easy to get through, and really fun actually. There's some parts of it where you'll be laughing for sure. So we really want to make the whole experience positive, but do it in a way that maybe you haven't experienced before, that really helps us though understand you and achieve treatment goals in an order and in a way that is safe and helpful, but to give you that final, help you achieve your oral health goals in the end. So I really hoped you liked that video on the new patient experience. We are going to be doing more parts, of course, to do with the new patient experience. That was just part one. So we'd like to have the hygiene appointment and all of the things that are involved in their cleaning for next week's video. And until then, make sure you like and subscribe, and I will see you next time.